Hello, everyone. Welcome to our webinar on how to prepare for the OCE. This webinar is going to be very action-packed. I'm going to try to have it all done within about 40 minutes. So just hold on tight, lots to go through, but we're going to get through it. I really do. I rehearsed, is that the right word to say? Like I went through it and I timed myself and I got it done in like 38 minutes. So I think I can do this. Anywho. Welcome. For those of you who it's your first time coming to one of our webinars, hello. My name is Caitlin Proctor. I am a Canadian trained physio out of UBC many years ago. And the last, 10 years of my career has been spent, for the most part, I do work as a clinician as well, but for the most part, it's myself. And at this point, we have 31 other people on the PT exam prep team. So it's a very large team. And we help people prepare for the licensing exams. What we're going to be doing today is talking about the OCE, talking about what we know about the OCE, and then diving into some kind of tips for your prep. Okay. So one of the big things I want to chat to you about right now is I want to know the answers to this question. And I hope by now you all know it. I've been posting about this so much on Instagram, but do you have to live in Ontario to write the OCE? Yes or no? Good. There should be an overwhelmingly amount of no. Anyone who tagged in the poll, anyone who said yes, I personally messaged them to be like, no, and here's why. So hopefully everyone knows the answers to that now. Okay, so here are some questions and some things that we know about the OCE and the way that it is at this point. So when we look at past exams, we're seeing a fairly consistent output for marks. We're not really getting how should I say this? We're not really getting these kind of fluctuating marks, meaning if you put the effort in and you study the right way, we're seeing that those people pass. Now, I can't say the same for exams that are in Alberta, BC, even the written exam. There's definitely a high correlation between those who do the right thing and pass, who prep properly and pass, but there are far more outliers in those exams than with the OCE. So meaning it's a little bit of a tidier journey. You put the effort in and the pass is a lot more likely with this exam. We like that, right? That's a good thing, great thing. We also know that the exam has been a little bit messy in that the questions and I shouldn't say the questions, the order in which things are asked or the experience that people have on this exam is varying greatly from candidate to candidate. So you can talk to one person and be like, it was so organized. My examiner gave me lots of probing questions. I finished on time. And then you can have other people who are like, my examiner, didn't really ask me much. There was a lot of dead air time. I gave my responses and then I ended with 45 minutes and I didn't know what to do, or the opposite, right? So it goes to show that there's quite a bit of human component to this in the marking. There are two markers on this exam. I should wait to go into all of that as we kind of dive in a little bit more. But yeah, I'll wait to dive in. Okay, the next exam that's coming up is June 1st to 2nd. I think that's about like 13 weeks away, which is absolutely perfect. My ideal study plan for this is around 12 weeks, so this is great. How many of you are doing the June OCE? Awesome. Seeing lots of me's. Great. Godwin, hello. Awesome. Okay. There's quite a few of you. I mean, not a ton. I would expect to see more. It does still say on the website that June 2nd is open. However, it said registration closed on February 19th. So we're going to talk a little bit about that because I know that sometimes people have different experiences. So one of the things that I did want to ask you was a bit of like an administrative style question. So there should be two questions that just popped on your screen. The first one should say, have you or anyone you know been given a spot for the OCE from a wait list? And if yes, how much notice did they receive? So can you tell me? Now, I appreciate the results are definitely going to be skewed more towards no on this one because it's, not a lot of people know a lot of people, if that makes sense, that are prepping for this. Okay, so please put your answers in. I'll close it in 5, 4, 3, 2, 1. Okay, I'm going to share the results with you. This is interesting. I definitely have heard people get in on the wait list, so I'm slightly surprised by this, to be honest. Of those who said no, is it just because you just don't really know anyone? Can you type in the chat box? If that's the case, you just don't really know anyone else doing the exam, just say yes in the chat box. Yeah. Okay. I am seeing one person say they were on the March wait list, they didn't get a spot. Okay, so pretty much the majority of people who said no, they just don't know anyone else who was doing it. Okay. Okay, that's helpful. That's good. One of the other questions that I wanted to ask, sorry, I'm just gonna cancel that. One of the other questions I wanted to ask you is going to be put onto your screen now. And that is, which exam are you preparing for? Are you preparing for June, October? Where are we at for people here? Because I did see people type it, but there wasn't a ton of you. So I'm very surprised to see that most of you here are for October. We've had a pretty consistent amount of students in the course for each of the exams. Like if we look at October to January, I think we had almost the exact same amount of students, which is kind of weird. But we had almost the exact same amount of people that registered for the course. June has been a little bit slower, so I'm interested. We still have a bit more spots for June, and normally we're always sold out at this point. So something to consider. Look at this. There's quite a few of you who are unsure if you'll take the OCE. Okay. I am going to share those results with you so you can see that. All righty. So a few more things that we know about the OCE. At this point, results are taking about 4 weeks. They're saying it's longer on the website, but we are seeing it to be a little bit quicker. The last exam was January 20th and 21st. And we don't have the marks back for that yet. So probably sitting more around 6 weeks at this point, potentially 8 weeks. So we'll see how that goes. Okay, I already put the poll questions out there. I want to know in the chat box, who is currently registered for the OCE and lives outside of Ontario? Do we have proof that these people exist? Yeah, awesome. So someone just messaged me, yes, but they're just messaged host and panelist, so you guys can't see it. Anyone else? Yes, awesome. There we go. There's Kareem. So the two of you that messaged me, very surprised there's not more. There's actually not a ton of you guys here right now. Okay, for those you two, can you just give me a number out of 10, 10 being like it was super, super easy. Wait, let's go 1 being it was super easy, 10 being it was like the hardest thing you've done as far as paperwork wise. How difficult was it? 1, super easy, 10, super hard. Yeah. Okay, so I'm getting ones. It's very, very easy. So for those of you here who are considering doing the OCE and do not live in Ontario, the process is very easy. So don't get too flustered about that. Okay, let's dive in. So what do we currently know about the OCE? Well, we know that it's based on the blueprint and the essential competencies. Now, I'm going to be honest with you, I do not find these very helpful. I think that they're kind of like a bit of a cop-out. It's like, here are some things that maybe sort of could be on the exam, but they're not in depth at all. Okay, it's the same thing you would have had for the written. You can also see the domains are there too. The domains, again, they're not very specific. So we look at something like management, which arguably I'd say is one of the easiest domains to kind of like connect to what you're going to do on the exam. And you're going to have things like apply best practices for infection control, identify risks and mitigate hazards, managing your own time, address discrepancies. So all of this is absolutely covered in our OCE course. If you are not in the course, this is going to be something that you're going to want to break these down into like each one into like 10, 15 small categories so that you don't miss any potential questions from these. I just got a question in the chat box saying, is the OCE accepted in BC? So I'm going to phrase that question a different way. If you pass the OCE, where can you work in Canada? Just Ontario or everywhere? It's accepted anywhere. So once you pass a clinical exam, you can work anywhere in Canada. So You can take any clinical exam that you want. I feel like a little bit of a broken record of this because I've definitely talked about this so many times, but clearly there are people that we need to reach this message out to. So please share the word, spread the word. Okay, so we also know that the OCE is a two-part exam. Part 1 has 2 cases, at least one of those are going to be MSK based, and then part 2 has 11 vignette cases that are more around those kind of like domain style of questions. So in part 1, you are going to have 2 case studies that will be presented on different situations. The scenario that we have been hearing from students can be upwards to 2 to 3 pages. Like this is just the scenario. That's so long. You'll then need to analyze the scenario and respond to the questions that are being asked by the examiner. Okay, each case will follow a standard template and approach. Now, I wrote under this has definitely not been the case. We're seeing that students are very frustrated when they leave because their experience, as I kind of already mentioned at the start of this, has just been different than their peers. So don't get too stressed by that. I think the big thing to know going into this exam is that there's going to be an element of disorganization. They're asking you verbal questions. I do, for the most part, think they're trying to get you marks. And so they'll go back to the things, maybe they ask you a question. And if you are getting asked what you feel is a question that you've already answered, stop for a second and think to yourself, if they're asking me this, it's because they didn't get what I was saying before. So you need to rephrase it. You need to give that information to the examiner again, because whatever reason, maybe they checked out for a second, maybe they genuinely just don't feel like you're explaining it well enough to give you marks. But if they're asking you something again, know that it's probably a good opportunity to explain what you were explaining previously a little different so they can give you those marks. Okay. We know for part 1, they're pretty much going over the assessment portion. So you're accepting the patient, you're going over informed consent, doing your clinical exam, which means your subjective and objective exam, and then giving your clinical impression. Versus case 2, we're dealing more with the treatment side. So case 1 assessment, case 2 is treatment. And in that treatment, we're talking about a very kind of comprehensive treatment plan. So what does it look like from a physio standpoint? What are we doing for goals, collaboration? How are we monitoring this patient? How are we pushing them through their stages of healing or stages of rehab? Okay. And then ultimately, what are we doing to discharge them or transition them? Here is a case study that was put on the Ontario website. I'm going to stop talking for about 30 seconds so you can take a look at this, okay? All right. Now, it frustrates me for you guys that this is not an answer key that is on the website. I feel like if they're going to release a practice question, why would you not release an answer key? But don't worry, if you are in our course, you will see the answer key that we've created for this, so you can go take a look at it. Okay. But ultimately here, I want to point out some differences. I think this case is a little bit small as far as background information, at least from what we're hearing. You can definitely see that there are examples of probing questions here. However, they're usually just going to ask you one at a time. You're not going to get this list. You're going to be given one question. So for this case, describe the steps you would take to conduct the assessment, right? That could be the question they ask. From there, you get 5 minutes to prepare for each core question, and then you dive into your probing questions. Okay. All righty. Now, what do you need to know for the OCE? So the big thing is you need to know content from any area of physio. You absolutely need to know this, okay? You are going to need to know your kind of main pathologies, and then you'll need to know these kind of maybe comorbidities or subpathologies, as well as potentially different impairments associated with that, okay? So if I go back to this question here, you can see from looking at this, sorry, my Zoom bar is blocking it. You can see here that the patient is saying that they're independent, they're in acute care, they fell. It's not really giving us their main pathology until we go down to here. So they're showing that they've got some comorbidities. Their main pathologies that we're dealing with here are left hip replacement, confirmed x-ray is non-displaced, nothing in the head, and then they've got some issues here. Right? So you can see how you kind of have your main pathology, some subcomorbidities, and then you have impairments, right? Definitely having some balance issues. And so from there, you are going to respond to those cases, okay? So when I say that you need to be able to prepare, let me go back to this, for content from anywhere in physio, you can see that case is quite neat. There's not a lot of things, I mean tidy when I say neat. Quite tidy. Everything kind of relates to each other. This definitely is not always the case, okay? There is a large range of materials that can be tested on this exam. And remember, this is a what would you do exam, meaning you don't have to go and do it. Versus on a BC clinical or an Alberta clinical, I usually say that exam is more of a how do you do. So how do you do a joint mobilization? How do you transfer someone, right? You're showing these things versus this one is kind of what would you do for this case? So you need to get good at explaining your thoughts. You really need to get good at verbalizing what is in here. And the biggest thing of how to get what is in here to what is here is you need to have this organization, okay? So lots of content and you need to be able to organize it. So definitely focus on understanding your pathologies, how you would treat them, and your clinical reasoning is the big one. Again, not performing joint mobilizations or not mobilizing. Okay, so for how to prep for case one, what I want you to do is you're going to create a comprehensive review of all your examinable pathologies. Okay, so what I like to call this is key information that could be presented in the case. So you're going to look at a pathology and you're going to say, okay, what in the case could make me think they have this? Or maybe they just tell you they have something. So maybe they tell you they have emphysema. And then you want to be able to say, like, what additional information could be presented that leads me to, pull from impairments? What are common impairments with people with emphysema? Okay. Now, we give you a subjective template that we want you to use. You're going to go through your subjective history following our steps very, very specifically. And then as you are memorizing and learning about each pathology within our course, we also are going to tell you any additional questions that need to be asked, okay, for both the subjective and objective exam. And then for every pathology, you also need to know how to treat them and potentially any safety considerations. I'm going to put this into an example for you because I feel like that makes it all come together. Okay, this is showing restrictive lung disease. So we're showing the key information that could be presented in the case. This is going to be for pulmonary fibrosis. So you can see here what the etiology is. You can see here what the signs and symptoms are. And then we're going to give you those additional questions. Remember, you're sticking to the subjective framework that we give you, but you would also ask, are you on any supplementary oxygen? You would also ask for your objective exam to measure thoracic range of motion and test chest expansion, right? Then it's going to give you your general approach to treatment as well as your safety considerations, okay? So we do this for every single pathology, like seriously, every pathology. It's very, very laid out for you. So you know exactly what you need to hit to make sure that you're not missing anything for these patients, okay? So I also just want to draw your attention to the fact that within the classroom, we're going to show you all the different frameworks for these core questions that they're going to ask you, right? It's very important, as I've already said, to organize yourself. And one of the biggest places that you need to organize yourself is going to be through the subjective and different objective exams. So I said when you're doing a subjective, we're just doing one. For the objective, we have different objective exams. We have an MSK, we have a neurological, as well as a cardio-resp. Within each of these frameworks, we're going to make you understand what you're going to be looking for, as well as giving your why. Remember, why is going to be so important on this exam. So we show you why is this important. See how many times it's written in there? Those are all those gray boxes. Why is it important? Okay. Alrighty. So a big thing that I want you to make sure that you're aware of, right? Let me just get out of here. So a big thing I want you to make sure you're aware of is that you're prepping for every scenario. So again, how are you going to conduct MSK versus cardio versus rest versus neuro for your subjective? Again, if you're in our course, you don't have to worry about breaking this down. It's already been done for you. All you'll need to know is as you're going through your pathologies, there might be small extra questions you're going to ask, just like in that pulmonary fibrosis, you're going to ask about supplementary oxygen. For the objective exam, you're going to measure their chest expansion, right? Because we know it's a restricted disease. All righty. So the next thing is we always want to make sure we're performing special tests just to have a very kind of fulsome answer when we're looking at these. So that is all going to be there, as well as outcome measures. Outcome measures are big on this exam, okay? And explaining why. Again, all those gray boxes. We're explaining why things are important. And that needs to be something that you are training yourself to do. We are in a profession where we like internalize a lot of thoughts, and then we go and do kinesthetic things. We go and touch people. We go and move them. We go and teach them. We move them. We move us. This is not that. This is verbalizing what you would do. This is a different muscle that you're flexing, and it absolutely needs practice. You need to make sure that you are communicating in a very organized way your why. I've said this enough times, right? Okay, we're using frameworks. Alrighty, so now we're moving on to part two, case two. So remember, case one is all about assessment. Case two is all about treatment. So we're developing a plan, we're developing goals, we're collaborating, we're monitoring, we're potentially discharging, okay? This section is definitely where people are struggling. We have a great trick in this section that is going to make it so much easier for you. That is the little nugget of goodness that is going to kind of stick within the course. But honestly, it's really, really lovely to just have these frameworks for each of your main questions. Okay, I'm going to give you a little bit of a hint, and that is we want you to create a problem list, and you're going to use this to answer literally every single question within part or case two. But how to do that and how you can make that apply to every question they're going to ask you is a little bit of our secret sauce. So, Sadi, you have to wait for the course if you want to see that. Okay. As I go and almost show it to you there. So for part two, so remember part one, we had our cases. Those were two big cases, assessment and treatment. Now part two, we're going into our vignettes. These are 11 vignettes. It's a short 1-paragraph situation. And then you're having to go through your standards, code of ethics, clinical reasoning, and explain what you would do in these situations. Okay. There's some that are fairly easy, like supervision and assigning care to PTAs. I think for the most part, that's a pretty easy topic. Going down into things like conflict resolution, I think is definitely a lot harder. Prioritizing care and time management, definitely harder. It's a lot. Okay. Alrighty. So one of the other things I wanted to show you was another example, and I talk too much. So here, let me pause me and you can take a look at this. Okay, how do you feel reading this? Like, give me 10 is the hardest. This is so hard. And 1 is like, this is super easy. Where are you at with this? I was expecting to see like 1s and 2s. I'm getting like 3, 7, 5, 6, 4, 6, 3. A lot of you are sending it just to me. 2. Okay. This seems like a fairly easy question. Maybe I'm too far in the details. I read too many and prepare too many questions for the OCE. But ultimately, I think this is a very fair question. I think there's a very clear answer to this. I think having the question be in the scenario, what concerns do you have, if any? And the follow-up questions are, how do you proceed? Explain what you would take as your action and tell me about a conversation. These are all very, very fair questions. And ultimately, I will tell you that our students who are doing part 2, for the most part, they're not having an issue, except if they're running out of time. They spent too long on part 1, case 1 and case 2, that they're running out of time in this section. And that's what I'd say is the biggest issue. Now, what you need to know to do well in this section is that you just need to have a strong understanding of practice standards and how they apply to day-to-day life. And this section of the classroom is very, very detailed. Like there's well over 100 and I don't even remember how many scenarios we have, but there are so many scenarios in this. So you are definitely going to feel 100% confident in this section. I strongly feel that. Okay. You need a very specific understanding of scenarios. You absolutely have to be by the book for this. So this does take a lot of prep and memorization. Okay. Again, following what would you do situations and explaining your why. Now, just want to give you a little bit of confidence. This again has been a relatively easy part of the exam. So do not stress about part 2, a very manageable section of the exam. Okay. Now I'll show you a little sneak peek into this. Okay, let's show you the online classroom. So this is what it'll look like when you log into your part 2 classroom, Vignettes for the OCE. So as you can see, we've gone through every aspect of those 11 vignette questions. So in order to do that, we've gone through all the standards from the Ontario College as well as all of the resources, okay? So what you're going to find is all along here is where all the content or all the knowledge that you need to learn is. So let's go through, if we think about that question about the gym owner having a monthly membership in exchange for referring clients. So if you go to some of the sections in this idea, that's a conflict of interest. We'll go here, you can learn about what a conflict of interest is, and you will kind of go through all the different content areas to make sure you can answer all questions around this. So we kind of go over the definition, some keys to avoiding it, and some key points. It's important to note that physios cannot benefit or give benefits for a patient referral. Referrals need to be based on needs. The proper way to offer a referral is to provide a range of options. So again, that was conflict of interest. I'll show you a good practice scenario there, but some other ones, I guess that'd be kind of fun to show you is maybe some commonly seen professional issues. So we talk about disclosure, how to deal with gifts, how to deal with treating family, so on. It's all there. And again, that's for each of these content areas. So tons and tons of information in here. Like it's a lot. Yeah. Okay, so then you'll scroll down and you'll get to your vignette questions. So those are those 11 content areas that you're going to go through. We'll go to conflict resolution. We'll pick a scenario that is literally just like what they posted for their practice scenario. So a new physio clinic focuses on neurorehabilitation has recently opened and the owner is looking for ways to attract new patients. She decides to head to the outpatient rehab facility and one of the local hospitals to speak to their therapists. The owner decides to offer the therapist a $10 referral bonus for all clients sent to the clinic through the outpatient program. Recognize the conflict or potential conflict and apply conflict resolution principles. Now this right here, apply conflict resolution principles, is directly from one of those domains in the essential physiotherapy profile that we talked about earlier. Okay, but let's take a look. So the answer key is right underneath. I'm a big believer in frameworks, especially with these, because you do want to have a very systematic approach. You do not want to be a robot. You do not want to have kind of a script at looking at these stations or these questions, but you definitely want to have a very organized approach here. So one of the frameworks we go over is recognize the conflict. I don't want to give away too much of the course, but ultimately it's a pretty easy step-by-step process where what is the connection between the persons. So in this situation, the clinic owner's influence over the physio who work with the patient at an outpatient facility at a local hospital. The therapists have influence over their patients as they are a trusted person in their care plan. Next, is there potential for financial benefit? So yeah, there is definitely potential for financial benefit if the clinic owner is paying the other therapist to refer them, right? So is there a conflict of interest? Ultimately, because you're recognizing the issue, yes, there is a conflict of interest in this scenario. The physio must not give any benefit to another person or receive benefit. So can these actions be justified? In some situations, you will find the conflict of interest actually can be justified. There are reasons or how you could kind of go about changing the scenario or changing your outcome to make it an okay situation. But in this, it's a very hard and fast rule. This is such a great examinable question because the situation presents with a conflict of interest that should be dealt with in another way. There's no way to get around giving referrals, money for a referral. So ultimately, we've recognized the framework, and then we're going to go into our conflict resolution principles. So we need to understand the issue, and that's that the clinic owner should not have any benefit to gain any benefit. We should discuss alternatives. So maybe instead of offering a bonus, the owner should try to network with therapists and educate them on what they provide, right? They could maybe provide brochures and business cards and ask to be added to the handout that should be given to patients that list other options. Okay, so there you go. That's pretty much the question that was exactly on this on the OCE example question, and it's clearly defined in one of the 11 stations that we go over just in conflict resolution. And remember, there are over 170 stations to go through. Whew. Okay. Well, thank goodness that I recorded that because I reminded myself there's 170 cases. There you are. Did people find that helpful to kind of see the breakdown of that question? Yes, no, maybe so. Yes. Okay, awesome. So I'm going to give you a few more tips. You got 7 minutes and you're gone. You're done. You're out. You got so much goodness. Give me 7 more minutes. Okay, let's show you the online classroom. So here we are. So I really do encourage you to start early with this prep. If you're pretty much everyone other than when start that, scratch that, we want rewind. Pretty much everyone who is preparing for this exam is working as a physio, except for those who live in BC. That's what I was trying to say, because there's no interim license in BC. So it's important to start early because often you are also working. If you are in BC and you're planning to take this exam, I think you can really get away with a much shorter time frame for studying because you're not working as a physio, right? I often get asked if working as a physio will help you with this exam. I think working as a physio is going to help you with anything. It's going to help you financially. It's going to help you get more experience. It's going to help you be put more onto the spot. So ultimately, yes, I think it's going to help. Now, is it worth it to punt your exam like a year down the road? Absolutely not. I think that you should try to take your OCE within kind of 4 to 6 months of your written, absolutely longest. I really do. There's so much momentum that comes from studying for your written. Get this registered, get ready, get it in the books, get it on the calendar as soon as you get that pass. Okay. If you want to start really early, so say you've passed your written and you're like, no, Caitlin, I need some time, then what I would tell you to do is reflect on pathologies you see during your clinical practice and then look them up into the classroom. Start making that contextual knowledge database in your head of here's what I saw, here's how it's going to be potentially examined. So I'm going to memorize this. It's also going to make you a better clinician. Okay. Great question. How long are you going to have access to the materials? So we go back and forth with this. We are definitely, for the month of March, we are committing that if anyone registers, they will get access until they pass. So there's not going to be an end date. Most of our products have end dates. We're not putting an end date if you're registering in March. Okay. So if you know you're doing it next year, that's fine. Just let us know at the time and we'll just put an extension into your account. Okay. So I really do encourage you to break down cases, focus on learning small portions rather than the whole case. We do this during our bi-weekly mini case discussions. These are all done online. You can attend these from anywhere in the world, and we're going to be going through cases every bi-weekly. Okay. They are recorded and they are also put into the classroom. We usually keep about the last month's worth up, so you'll be able to watch those. Okay. We definitely recommend a 12-week study plan if possible. This means if you start today, you'll be well prepared for June. There are 32 weeks until the October exam. And so I don't want to lose you here, but there are multiple different study plans in the course. If you were to take, say, the 8-week study plan, you times it by 4, that gives you 32 weeks. That would mean in the 8-week study plan, for every one day, and I'm going to show you the study plan, for every one day, you would take 4 days to get through it, right? And that would take you to October. Pretty much no matter when you start prepping, as long as it's more than 6 weeks before, we're going to have a very great study plan for you. Okay. So don't get too worried about when you're starting. I would just focus on starting earlier rather than later. Many candidates do opt for this long one. However, we have tons of people who opt to do it in 6 to 8 weeks as well. This is a unique exam, so please make sure that you are practicing, okay? You want to follow our study guide, and I have a very special little surprise that I'm going to put in your webinar takeaway email. It's a delicious surprise. I promise you. I'm pretty much giving you like cases for free and video recordings of me explaining them, okay? So it's a good one. Make sure you check your webinar takeaway email. Here is an example of our 12-week study plan, so you can see what is required. It's not crazy. So for example, on day 36 of the study plan, you'd be going through ankylosing spondy, carpal tunnel, cervical spondylosis, and cervical headaches. That's it. For example, day 40, you would be going through case 2-2. So 12 weeks is absolutely doable, okay? Alrighty, I was showing you this here. Our OCE prep course is incredibly detailed. I am going to go on the record saying of all the courses we've ever created, the OCE prep course is my favorite. I think it makes you a very, very strong clinician. I think it really works on your clinical reasoning, and it is going to make you look at patients differently. Truly, it will. It's going to work on that clinical reasoning aspect that I feel so many internationally trained physios are lacking. So this is one of those things that's, yeah, it's going to help you pass the exam. Very important. But I think you're going to leave here being a substantially better physio too. So you have your part 1, you have your part 2, you get your live one-on-one mock. You also get a customizable study schedule, and then you get these bi-weekly case sessions. Okay. Now, the course is normally $14.99. We do have discounts available. So we have a discount for anyone who took our written course. The discount is $400 off. That's the biggest discount we have if you've taken our written course. If you decide to register in a group of 4, you get $300 off. And if you register in a group of 6 or more, you're going to get $400 off. Okay. Now, what we've decided, if you register today or tomorrow, we are going to give you a code. You can use the code OCE webinar, and it will give you $200 off. We are just doing it for today and tomorrow. We are not doing it for people who registered yesterday. It's just going to be for today and tomorrow. I'm also going to do one other thing here. I'm going to post a poll again, and it's, are you looking to create a group? Okay. What we've done in the past is we will group people together so that you can get that large group of 6 discount. Okay. So yes, I would like to take the course and need a group. Please click that one and I will form a group for you and you'll get that large discount. No, I'm not interested in taking the course. No, I am already registered. And can you guys see this? Is this on your screen right now? Yes. Oh. Hold on. I need this to go out to you. Why not? Watch. Not in the screen. Okay, give me a moment. Here we go. Okay, so tell me, yes, you want a group? No, you're not interested. I'm already in a group, but I need help. I'm already in the course. I'm already registered, or I'm planning to register in 2025. Let me know where you're at. Good question. Will the discounts stack? They don't. Sorry, wouldn't have the ability to pay for all the things that go into this course if we stack them. But the largest discount we do is $400. If you are registered for the Ontario Clinic, or sorry, BC exam, yes, you can still register the OCE. Pavan, send me a message and we'll talk, okay? There's a lot of you that want to form a group, so I will break you guys down into different groups. I'll probably send a mass email out, and as soon as we hit that threshold of 6, then we'll give you access to the materials, okay? I'm gonna end the poll here and just share it so you can see There is a lot of you. Can you see the poll there? Yeah, a lot of you, like if you've taken our written course, you don't need to be in a group, totally fine, because you get the largest discount. We made the decision that we were going to give the largest discount we have to our past written students, even if people did groups, okay? We wanted the largest discount to go to our past students. All right, I am going to be with you done in 1 minute. I promise, I promise. Okay, so this was an email that was sent out by the registrar. This was sent out, I think it was sent out maybe in November or December, but they said that there was 262 candidates completing the exam over 2 days. Of that, 136 students were in our course, which is amazing. We had 138 in our course for January. Those results are not released yet, so we don't know how many took it. But I can tell you, when we look at October, our pass rate was 98%. And that includes you have to have passed your mock with us. There are many people who do not pass their mock. They show up, they're not prepared, they don't get the go-ahead. But if you get the go-ahead and you have completed the course, we have a 98% pass rate, okay? Please let me know what your questions are. If you are in our written course right now, this is being recorded. It will go into your classroom in the premium, the Canadian course. I can put it into the OCE course too, so you can see it there. Yeah, let me know what questions you have. Nothing, no questions. Okay, so remember, there's a special surprise going out in the webinar takeaway email. As a little spoiler alert, it's pretty much me going through cases, but it's in videos, which is kind of nice. So question, my OCE is scheduled on the 2nd of June. Can I take it? Absolutely, you can take it. You're the perfect candidate because I think there's about 13 weeks until your exam. So you are the perfect candidate to start studying using the course. Okay, I don't see any questions. One thing I will do here, I'm just going to post the link if you want to go check out the course. Remember, if you did say that you want to be in a group, please don't register now because I'm going to get you a group discount. So don't go and register now. If you are a student, a written course student of ours, you can contact us and we will give you the coupon code for $400 off. All right. And a question just came in. I just did my written in March. I've never worked as a PTA. When do you think it's the perfect time to take the exam? Great question. So I do think it's within that kind of like 4-month time frame would be ideal. Again, I don't know. Has anyone recently got approval for a June exam? My understanding is no, they're pushing it to October at this point. So you'd be going for October, which would give you lots of time to study. Pavin is saying, do we need any additional material or is the content in the course sufficient to pass the OCE? So here's what I'm going to tell you. I wouldn't go based off my word. I'd go based off of our students' words. And they are absolutely saying this is all you need. This is like, people aren't even bringing textbooks, nothing with them. They're just sticking to this. Even if there are small things that are in the case that are maybe something that wasn't covered, no one has ever said that it's been enough to affect how they've presented the information there. So I feel strong in saying that you just need the course. Dimini is asking, will there be any webinar for BC practical exam? As of right now, we don't have one, but if other people are interested, let me know. I can do that. Atika, clinical exam is after every 2 months. Ooh, no, so right now for the OC, we have January, March, June, October, so about 4 times a year. Yeah, and then for 2025 dates, how am I even saying the word 2025? 2025 dates, we're looking at January and March. So they're doing the same as 2024. So we could probably expect that they're going to continue to do January, March, June, and October. Okay, someone is asking, what if you don't clear the exam in the first attempt and 1 year has passed from the course registration? Don't worry about that. I'll tell you something. If anyone is with us and they are unsuccessful, don't worry. I will meet with you. We will make a plan. We will figure out what happened. 9 times out of 10, when someone's unsuccessful, it's because life happened. They weren't able to study. They kind of know what they were supposed to do. They just weren't able to do it. But don't worry, if you're registering in the month of March, we're not putting an end date on your account. Well, technically there is an end date, but we're extending it until you need it, okay? Okay, I think that is it. Thank you so much, everyone, for joining me. Look out in your inbox very soon. I'm going to be putting those groups together tonight, so I will get that going for you, okay? Bye, everyone.